Hello and welcome to Connected Conference 2025. My name is Lisa Schaefer and I'm the Executive Director here at Obesity Canada, and we are thrilled that you've been able to make time to join us this week. This year, we're trying something new for our Connected Conference. Our sessions are designed to be on demand and flexible so that you can watch them at your convenience. We want to allow you time so you can absorb new insights and reflect on how they might apply to you and your community. But we're not stopping there. We're also trying something new, and we're hoping that on Friday, March 7th, you will join us for a live roundtable discussion where we're going to bring together experts, advocates, and you, our incredible community, to connect, to collaborate, and inspire some real action on obesity care in Canada. In the spirit of building connections, I also want to encourage you to join OC Connect, our private online peer support community, where you can engage with others who have similar experiences and insights. I also want to make mention that you have the real opportunity to help us shape the future of obesity care in Canada and what Obesity Canada looks like. We are having a stakeholder survey available to the public until March 7th, and your voice is essential in truly implementing meaningful change. And meaningful change is needed because we know that obesity isn't just one person's challenge, it's all of ours. This complex chronic disease that's influenced by biology and environments and the systems that we live in for too long has been misunderstood. It has been simplified and it has been stigmatized. And that's why we're here. And that's what we're trying to do. We want to shift the conversations. We want to take everybody from judgment to understanding, from outdated stereotypes to science-backed solutions, and from isolation to action. We know powerful change comes from making connections. When research meets action, when education inspires change, and when advocacy amplifies voices, we truly transform lives. This isn't a simple journey, but it is one worth taking. Change happens when we come together and use our collective voice. So across 2025 and beyond, you will see Obesity Canada calling on policymakers, healthcare providers, and everyday Canadians to join us, to challenge the bias, to break down barriers, and to rewrite the narrative of obesity in Canada. With our collective courage, I truly believe that we can build a Canada where health is not defined by size, but rather the freedom to thrive. These are important conversations, and again, we are thrilled that you are here to join us. I also want to thank our generous sponsors who have made the event possible this year, but really, thank you for being part of Connected 2025, and thank you for believing that better is possible. Let's go make this amazing.
Hello, and welcome to Obesity Canada's annual public virtual conference, Connected 2025. This year, the theme is It's Bigger Than Obesity, Connecting the Dots in Obesity Management. We know that obesity is a complex chronic disease, but we also know that it's one that doesn't often happen in a silo. It's connected to a number of other important conditions. So we wanted Connected 2025 to focus on some of the other important intersections that happen with obesity management. Today, we're talking about obesity and cardiovascular disease. This session of Connected 2025 is brought to you in partnership with the Canadian Cardiovascular Society. We would also like to take a moment to thank our sponsors for this conference who have made this possible. Thank you to Shoppers Drug Mart, Pfizer, Novo Nordisk, Boehringer Ingelheim, and Johnson & Johnson. Connected is our annual public conference for World Obesity Day. You can find the archives of previous conference recordings on the Obesity Canada YouTube page. This year, we're spreading the virtual conference out over the course of a full week. So each day we have a keynote session released here in the virtual venue that you can watch on demand. So make sure you're coming back each day to check out what's new by clicking on the on-demand video section. In the lobby, you'll find valuable information about our sponsors and speakers, discover the sponsors who make this week's conference possible, and explore details about our speakers, including their bios. On Friday, March 7th, we'll wrap up the week with a live roundtable discussion featuring Dr. Sokolingam, Dr. Proter, Lisa Schaefer, and Ian Patton. This dynamic conversation will take place at noon Eastern Time and will provide insights on how we can all take action to be a part of the shifting tides in obesity management. Throughout the week, if you have any questions that come up, please either make note of them and bring them to Friday's roundtable discussion, or you can send your questions directly to Ian at obesitycanada.ca. We will do our very best to answer as many questions as we can. My name is Lauren Gates, and I'm a non-healthcare professional living in Calgary, Alberta, and a member of the OC Connect community. It's both an honor and a pleasure to be your host for this week's conference. With a personal connection to obesity, my goal is to bridge the gap between patient lived experience and personal practice, fostering a more compassionate healthcare environment. I hope that the conversations we have this week will inspire greater empathy, deeper understanding, and more effective patient care while providing education and support to those impacted by the complex chronic disease of obesity and its related conditions. Okay, so now on to today's topic, obesity and cardiovascular disease. With us for the discussion, we will have Dr. Jodi Heshka from the Ottawa Heart Institute. Dr. Jodi Heshka is a cardiometabolic medicine specialist and director of the Guideline-Directed Medical Therapy Clinic. With a background in internal medicine and cardiovascular care, she has spent over a decade improving heart failure management, lipidology, and diabetes care. Dr. Heshka has led community-based heart failure programs, contributed to Canadian heart failure guidelines, and advised on national committees focused on cardiovascular disease and diabetes care. She is also a dedicated educator at the University of Ottawa Faculty of Medicine. So welcome, Dr. Heshka, and thank you for joining us today.
Thank you so much for having me. It's such an honor to be here today.
Wonderful, thank you. So, okay, let's kick things off with a little bit about the topic. So heart health is a really important issue and one that's of a big concern for many of our community members. It's also getting a lot of attention in relation to obesity. So given some of the research that's been coming out for obesity treatments and indications related to cardiovascular disease, I'm really excited to dig into this. So I'd love it, Dr. Heshka, if you could just start off by telling us a little bit about the work you do and what got you interested in this space.
Absolutely. So I've always been really interested in cardiometabolic health, which is, of course, the area of medicine that deals with the effects of diabetes, obesity, metabolic syndrome, and associated conditions on vascular health. We have seen across the world, and in particular in North America, rapidly rising rates of metabolic disease. And we are now appreciating the fact that metabolic disease truly is a cardiac risk factor. It is on the spectrum of cardiometabolic disease. Fortunately, this is a really active area of research, and the area has significantly evolved over the last decade, if not longer. And so now we have so many different tools at our fingertips that we can use to help educate and treat obesity and thereby improve heart health outcomes for patients. And so because of all that's happening, all the research, all the data that's coming out, it really is an amazingly exciting time to be involved in this space.
Amazing. Thank you. So let's jump right in. Can you talk about the intersection of obesity and cardiovascular health? For example, how are these two conditions related and how common is that intersection appearing in your practice?
Absolutely. So increasingly, this intersection is being seen in my practice more and more frequently. And I can't emphasize enough how this is really on a spectrum of disease. So obesity is a chronic condition. It is a cardiometabolic illness. It is not a stereotype. It's not a bad habit. And we're really learning now how to better support patients struggling with this condition. Good management of obesity includes emphasis on preventing the cardiovascular outcomes or complications that can unfortunately come along with this, such as coronary artery disease, atrial fibrillation, and heart failure. Increasingly, we're seeing obesity as a major cause of heart failure. And so more now than ever, we're seeing this connection between obesity and various different types of cardiac illnesses. Historically, we have always treated heart disease and obesity very separately. And I think one of the things that's really exciting to see now is that we're really doing a much better job trying to approach this as one condition, which is what it is, just with a spectrum of presentations.
Amazing, and good segue for my next question. So what does cardiovascular disease look like, and how does obesity management fit into that equation?
Yeah, so cardiovascular disease and obesity, again, can be looked at as two sides of the same coin for many, many patients. Obesity in and of itself can directly be a trigger for various types of cardiovascular disease, such as atrial fibrillation, such as atherosclerosis or heart failure. But importantly, we also know that obesity can be a driver for other cardiac risk factors. And so often the risk of cardiovascular disease can be exacerbated or compounded. Obesity can underlie things like high blood pressure, insulin resistance, diabetes, sleep apnea, uh, to name a few different conditions. And so again, to really do a good job in improving heart health among people who are living with obesity, it means looking at the big picture and thinking very broadly.
Mm-hmm. So would your treatment for cardiovascular health be different for someone who is living with obesity versus someone who is not living with obesity? Or is it sort of a case-by-case situation, looking at all the whole person and all the factorial powers at play, if you will?
I think more and more we're learning just how important it is to individualize, to really listen to patients and to have a good understanding for those living with obesity, what it means for them and what their particular challenges are, so that we can streamline care and make sure patients are getting the best care possible in a very supportive environment. But I do think it's also important to acknowledge that by really focusing on good weight management, the long-term benefits are huge. So by this I mean, when I focus on helping someone with their struggle with weight or obesity, in good treatment, ultimately we often end up improving some of the other cardiac risk factors. So if at the end of the day we're really looking to support good heart health, then targeting the weight management really pays it forward.
Beautiful. Okay, love that answer. So we've known for a long time that there's a correlation between obesity and a number of health conditions. But as the obesity space has evolved and our understanding of the obesity disease has advanced, there's more discussion about obesity being viewed as an upstream condition, and effective treatment of obesity is an important part of treatment and prevention of potentially downstream conditions like cardiovascular disease. So what are your thoughts on that? And in your experience, have you seen a shift in how obesity is approached in the world of cardiology?
Yeah, so when I say that, treatment of obesity can really pay it forward when it comes to heart health, this is exactly what I'm getting at. When we look at the spectrum of cardiometabolic disease, for many patients, obesity may be just the entry point of that spectrum. And what we want to prevent is progression on that spectrum. And so that's where I think we really need to focus our efforts. And more in cardiology, I think cardiac specialists are starting to appreciate this. If you look at our own Canadian Cardiovascular Society guidelines, in many guidelines for individual conditions now, there's emphasis placed on appropriate management of risk factors, including obesity. And I think more and more cardiac specialists are shifting away from, living in their little silos of specialty to appreciating that heart health, and heart health in particular in people struggling with obesity, is really a global approach. To treat one well, you have to treat them all, whether it's the heart disease, the weight, the diabetes, etc. So there's a combination of individualization, but also this broader appreciation of any individual's unique risk factors.
Mm-hmm. Interesting. So I'm curious, whenever a patient sees a specialist for something like cardiology, I can imagine time is a pretty precious resource. Even general practitioners only have potentially 10 minutes to have conversations. So I imagine, we're trying to fit a lot into a small amount of time. So you can likely not address potentially all of the things that are related to heart health that are relevant for the individual in that time, like obesity. So how do you prioritize, and what do you do in that meeting when you notice that maybe obesity is complicating cardiovascular health? Sorry, I know that's two questions, so one at a time, please.
You're absolutely right. Time is precious, increasingly so. I think one thing that has really been helpful in delving into risk factors and getting a better understanding of them for patients is for us to really use a team approach. There's no one person that can do everything. And so I think relying on our colleagues, relying on other healthcare professionals, relying on allied health can really help us delve into these things in a little bit more detail and to get a better understanding. And thereby allow us to do a better job of treating these conditions. So you had a second part to your question?
Yeah, it's about prioritization. So, what do you do when you notice that obesity is complicating the cardiovascular health? Like, is that a priority then for that meeting? And how do you target that in the conversation?
Absolutely. So it very much can be a priority for a meeting, assuming that there aren't any urgent or emergency issues that need to be addressed in a visit with a patient. Then really the focus shifts towards good risk factor management. And obesity is certainly a well-known significant cardiac risk factor. And so then the focus will be on how can we best help you or a given patient achieve their weight management goals. And I think, speaking on behalf of many specialists, depending on the comfort level with weight management or obesity care, it may be by a given physician. Certainly I can help patients with that, or as needed, referring to colleagues, to other experts in obesity management.
Mm-hmm. Beautiful. I'm curious about how that conversation looks. So we talk a lot about, having the conversation about weight with patients and doing it in a way that isn't, stigmatizing or shaming or blaming. What have you noticed works really well in cardiology around having empathetic, compassionate, and science-based conversations with patients?
Yeah, so I think, opening the door to conversation gently and then letting patients really sort of take the lead is important. So as an example, something that we like to use here a lot is starting out with facts. So we know that overweight and underweight both can have significant health consequences. And so we'll ask patients, is your weight an issue for you? Is this something that you would like to discuss? And if so, can we have a consultation on this and talk in a little bit more detail so that I personally can get a better understanding as to what the challenges are and how I can best help them.
Mm-hmm. Love that. So given obesity is a chronic disease, and it generally falls under the responsibility of primary care for management, I'm assuming, and may require coordination with other specialists for related conditions like cardiovascular disease. From your perspective as a specialist, what are some of the challenges or opportunities with coordination of care that you're seeing? And are there any tips that you'd like to share with general practitioners for making that coordination easier, some things that they can take away from this session?
So I think one of the challenges is that as humans, it's hard to change. And that goes for both doctors and patients. It can be hard for us to reach or to change how we think about things. But again, I think what's really important to appreciate is that obesity is a chronic medical condition. And so we as a community need to understand that and to have empathy towards patients who are struggling with this condition, much like any other chronic condition. I think even though it can be a challenge to be open to change, that openness truly is an opportunity. And so by being open, by reaching out to others, by trying to inform ourselves, by networking with others, this is how we really can advance education and research. This is how we can build fluidity in our communication with whether it's primary care physicians or whoever else is on the obesity management team. And this is how ultimately we really improve health outcomes in patients who are struggling with obesity.
For a patient who's concerned about their heart health, what types of questions should they be asking their general practitioner? What kind of tests are available, and what kind of symptoms might they be experiencing in order to prompt them to reach out?
That's a great question. So I think first and foremost, it's always important to check blood pressure, to check diabetes status, to check liver enzymes, to screen for fat accumulation in the liver, to get basically some basic blood work done to look at other cardiovascular risk factors. Another thing it's important to talk to your physician about are any new cardiac symptoms you might be having. So these are symptoms such as chest pain or pressure, unexplained or new shortness of breath, leg swelling that again is new or unexplained, palpitations, recurrent episodes of dizziness, or certainly if there's any fainting, then that's something that you should seek medical attention for so that, you know, the family physician, the nurse practitioner can initiate an appropriate workup.
Mm. So this week we're speaking about diabetes as well, and we're also speaking about sleep health and sleep apnea. Are there any things of note in terms of intersections with those two diseases that you'd like to mention, particularly when it comes to folks living with obesity?
Mm-hmm. So obesity and insulin resistance, diabetes, metabolic syndrome, for many patients, unfortunately, can go hand in hand. And we also know that in patients who struggle with obesity, there is an increased prevalence of sleep apnea. And so, it's important for patients who are struggling with obesity to ensure that they're, again, asking their primary care physician or their nurse practitioner to check their blood pressure, check their cholesterol levels, check their sugars. If they are struggling with sleeping or if they're having other symptoms of sleep apnea, such as snoring or frequent nocturnal awakenings or significant daytime fatigue, then again, that's something that they should raise or bring to the attention of their primary care practitioner.
Mm-hmm. Because the whole body's connected and it's hard on the health when things aren't working properly, I imagine.
Absolutely, absolutely.
So I'm curious, the Ottawa Heart Institute has done some really great work related to obesity in the last few years, from training and education to patient resources. Can you talk a little bit about some of that work, its importance and impact, and what else you'd like to see in regards to obesity and heart health happen in that space?
Sure. So, yes, starting a few years ago, we have organized a number of initiatives that have involved training our staff to be supportive, to be attentive to the needs of patients struggling with obesity. We've developed some patient care resources, including our booklet, Myths About Obesity, which is readily available. We have also developed a committee that's been dedicated to ensuring that all our patients, including those struggling with obesity, are comfortable when they come to our facility for cardiac care. And by that, I'm talking about ensuring that they're comfortable in the chairs they sit in, the gowns that they're wearing, etc. So everybody feels absolutely included. And we are now, through our prevention and rehab programs, offering medical consultations for interested patients who are struggling with obesity so that we can help get the conversation rolling about how we can best help them achieve their weight management goals. And for some patients, that might be simply using some of the newer medications that are on the market and getting them set up with a prescription. And for other patients, it involves working towards a streamlined process where we connect them with one of our community healthcare professionals who can provide longer term follow-up with obesity, because of course it is a chronic disease and so requires lifelong attention.
Mm-hmm. There's been some interesting studies and some things happening that I've been hearing in podcasts and different venues around how some of these GLP-1 medications can help with blood pressure and hypertension, which I imagine would be really great news for a cardiovascular expert. What are your thoughts on that? And is there anything that you'd like to take note or bring up about that science today?
Sure. So we know that weight and blood pressure can be very closely correlated. Patients who lose weight, particularly 5-10% weight loss or more, can often achieve significant improvements in various cardiac risk factors, including blood pressure. Patients who lose a fair amount of weight often can have significant reductions in their blood pressure. And so, again, it's about that big picture management and appreciating the downstream effects of obesity, and knowing that by treating obesity early on, often those downstream cardiac risk factors or conditions ultimately substantially improve, or at least become a lot easier to treat.
Amazing. Ideally, we can prevent or manage obesity early on before it progresses, or manage overweight before it progresses into obesity. But for the millions of Canadians who have established obesity, what are some of the steps that they can take to protect their heart health and prevent cardiovascular disease?
So first and foremost, I think it's important to appreciate that good treatment of any medical condition, particularly chronic conditions, often involves not just pharmacologic treatment, but also non-pharmacologic treatment. And so some of the things that people can do to start with is, number one, make sure that they're following a heart-healthy diet. There are lots of healthy diets out there that are heart healthy. Some examples include plant-based diets, or Mediterranean diets, low glycemic index diets. So looking up online or accessing resources through Obesity Canada to inform themselves about how to follow a heart-healthy diet. Portion control can also be helpful or important for patients. Making sure you're active on a regular basis is something that we should all be doing. But if you already have one risk factor, you want to try to do the best you can to stay on top or manage some of the others. So making sure that you're active, you're moving, whether it's with it's just some easy walking, swimming, whatever you enjoy doing, some lightweight lifting, just keeping your body active. Trying to address any other cardiac risk factors that are present. So for example, if you're a smoker, working on smoking cessation is a huge plus. Ensuring that if you have high blood pressure or diabetes, that these are being appropriately treated. Make sure that you're getting adequate rest, and stress management is an important part of your life. And then finally, of course, where appropriate, speaking with a healthcare professional about medical therapy, either in the form of medical diets or pharmaceuticals, if that is what is felt to be the right decision for any given patient.
Mm-hmm. So taking care of the whole body is good for the heart.
100%.
Yeah. If you could wave your magic wand, Dr. Heshka, what do you wish everyone knew about heart health and their cardiovascular system?
If there was one message I could really drive home, it would be that prevention really is key. We are going to exist in all different sizes, but if we are following a heart-healthy diet, if we are active, if we are getting on top of issues as they pop up, if we're seeking help, if we're proactive, that is how we get the best chance at a long and heart-healthy life. More and more when we look around in today's healthcare system, surely we can see now that we have to stop being so reactive and we have to be a lot more preventive. And so that's where we really should be focusing our efforts on helping people be the best they can be physically before any complications develop.
Beautiful. Thank you so much for joining us today, Dr. Heshka.
Thank you so much for having me. I want to remind everyone that on March 6th, the Ottawa Heart Institute has a great obesity education day that's been sponsored by Obesity Canada. So if you're in the area, come on by and check us out.
Fantastic. And thanks to all of you who have taken the time to join this conversation. We want to again thank the Canadian Cardiovascular Society for partnering with us on this session. A few Takeaways for me are going to be, for sure, that we want to take care of our entire health, what's good for our entire bodies, our mental, our physical, our stress, our insulin, our metabolic health, all of those things. Those are good for the heart. Health definitely comes in all different shapes and sizes, but the more that we can do those behaviors that promote a joyful and healthy life, the more that we can prevent potential cardiovascular complications down the road. So how do we keep this conversation going? Join us on OC Connect. Make sure you join us on Friday for the live roundtable, and come back to the virtual venue for tomorrow's discussion on obesity and liver health. Also, check out our website at obesitycanada.ca.